Accept assignment. Provider accepts as payment in full whatever is paid on the claim by the payer. Accounts receivable. The amount owed to a business for services or goods provided. Accounts receivable aging report. Shows the status of outstanding claims from each payer as well as payments due from patients. Accounts receivable management. Assist providers in the collection of appropriate reimbursement for services rendered. Include functions such as insurance verification, eligibility, and pre-authorization of services. Accreditation. Voluntary process that a healthcare facility or organization undergoes to demonstrate that it has met standards beyond those required by law. Adjudication. Judicial dispute resolution process in which an appeals board makes a final determination. Adjusted claim. Payment correction resulting in additional payment to the provider. Advance beneficiary notice. Document that acknowledges patient responsibility for payment if Medicare denies the claim. Adverse effect. Also called adverse reaction, the appearance of a pathologic condition due to ingestion or exposure to a chemical substance properly administered or taken. Adverse reaction. Also called adverse effect, the appearance of a pathologic condition due to ingestion or exposure to a chemical substance properly administered or taken. Adverse selection, covering members who are sicker than the general population. Allowable charge. See limiting charge, maximum fee a physician may charge. Allowed charge. The maximum amount the payer will reimburse for each procedure or service according to the patient's policy. All patient diagnosis related group. DRG system adapted for use by third-party payers to reimburse hospitals for inpatient care provided to non-Medicare beneficiaries. DRG assignment is based on intensity of resources. All patient refined diagnosis related group. Ambulance fee schedule. Payment system for ambulance services provided to Medicare beneficiaries. Ambulatory payment classification. Prospective payment system used to calculate reimbursement for outpatient care according to similar clinical characteristics and in terms of resources required. Ambulatory surgical center. State-licensed Medicare-certified supplier of surgical healthcare services that must accept assignment on Medicare claims. Ambulatory surgical center payment rate. Predetermined amount for which ASC services are reimbursed at 80% after adjustment for regional wage variations. Amendment to the HMO Act of 1973. Legislation that allowed federally qualified HMOs to permit members to occasionally use non-HMO physicians and be partially reimbursed. American Academy of Professional Coders. Professional association established to provide a national certification and credentialing process to support the national and local membership by providing educational products and opportunities to network and to increase and promote national recognition and awareness of professional coding. American Association of Medical Assistants. Enables medical assisting professionals to enhance and demonstrate the knowledge, skills, and professionalism required by employers and patients, as well as protect medical assistants' right to practice. 837. Claims Validation Table. ALMA, American Association of Medical Assistants. ABN, Advance Beneficiary Notice. ADA, Americans with Disabilities Act. AHA, American Hospital Association. AHFS, American Hospital Formulary Service. AHIMA, American Health Information Management Association. AMA, American Medical Association. ANSI, American National Standards Institute. APC, Ambulatory Payment Classification. APDRG, All Patient Diagnosis Related Group. ARPDRG, All Patient Refined Diagnosis Related Group. ASC, Accredited Standards Committee. ASC, Ambulatory Surgical Center. BC, Blue Cross. BCAC, Beneficiary Counseling and Assistance Coordinator. BCBS, Blue Cross Blue Shield. BCBSA, Blue Cross Blue Shield Association. BS, Blue Shield. BSR, Beneficiary Services Representative. CA, Cancer or Carcinoma. CAC, Common Access Card. CAC, Computer Assisted Coding. CAT, Computerized Axial Tomography. CCS, Certified Coding Specialist. DAC, Clinical Data Abstracting Center. CDHP, Consumer Directed Health Plan. CDHS, California Department of Health Services. CDT, Current Dental Terminology. CERT, Comprehensive Error Rate Testing. CF, Conversion Factor. CHEMPAS, Civilian Health and Medical Program of Veterans Affairs. CLIA, Clinical Laboratory Improvement Act. CMP, Competitive Medical Plan. CMS, Centers of Medicare and Medicaid Services. CMS 1450, UBO for claim used by institutional and other selected providers to bill payers. CMS 1500, Insurance claim used by non-institutional providers and supplier to bill payers. CNS, Clinical Nurse Specialist. COB, Coordination of Benefits. COBRA, Consolidated Omnibus Budget Reconciliation Act of 1985. CPC, Cedar Rift Professional Coder. CPT, Current Procedural Terminology. CRE, CHEMPAS Reform Initiative. CSCP, Customized Subcapitation Plan. CT, Computed Tomography. DCAO, Debt Collection Assistance Officer. DEERS, Defense Enrollment Eligibility Reporting System. DME, Durable Medical Equipment. NEPOS, Durable Medical Equipment, Prosthetic and Orthotic Supplies. MERC, Durable Medical Equipment Regional Carriers. DoD, Department of Defense. DRG, Diagnosis-Related Groups. DSH, Disproportionate Share Hospital. DSM, Diagnostic and Statistical Manual. EDD, Employment Development Department. EDI, Electronic Data Interchange. EFT, Electronic Funds Transfer. EGHP, Employer Group Health Plan. ENAC, Electronic Healthcare Network Accreditation Commission. EHR, Electronic Health Record. EM, Evaluation and Management. EMC, Electronic Media Claim. M, Electronic Medical Record. EOB, Explanation of Benefits. EPO, Exclusive Provider Organization. EPSDT, Early and Periodic Screening, Diagnostic and Treatment. EQRO, External Quality Review Organization. ERA, Electronic Remittance Advice. ERSA, Employee Retirement Income Security Act of 1974. FATM, First Look Analysis for Hospital Outlier Monitoring. FCA, False Claims Act. FDCPA, Fair Debt Collection Practices Act. FECA, Federal Employment Compensation Act. FEHBP, Federal Employee Health Benefit Program. FELA, Federal Employment Liability Act. FEP, Federal Employee Program. FMAP, Federal Medical Assistance Percentage. FPL, Federal Poverty Level. FR, Federal Register. FSA, Flexible Spending Account. GEM, General Equivalency Mapping. GEP, General Enrollment Period. GCPI, Geographic Cost Practice Index. GPWW, Group Practice Without Walls. HA, Health Affairs. Haven, Home Assessment Validation and Entry. HCF, Healthcare Finder. HCPCS, Healthcare Common Procedure Coding System. HCRA, Healthcare Reimbursement Account. HEDIS, Health Plan Employer Data and Information Set. HHRG, Home Health Resource Group. HICN, HEALH Insurance Claim Number. HIPAA, Health Insurance Portability and Accountability Act of 1996. HIPS, Health Insurance Prospective Payment System. HMO, Health Maintenance Organization. HPMP, Hospital Payment Monitoring Program. HPSA, Health Personnel Shortage Area. HRA, Health Reimbursement Arrangement. HSA, Health Savings Account. HSSA, Health Savings Security Account. AN, No, Not. AB, Away from. Abdomen, Abdomen. ACR, Extremities, Top. Add, Toward. Add, Toward. Adip, Fat. Al, Pertaining to. Angie, Vessel. Ankle, Crooked, Bent. Anti, Against. ARTHR, Joint. Access, Condition. ISIS, Condition. By, To. Blepher, Eyelid. Brachy, Short. Britty, Slow. ISIS, Condition. ISIS, Condition. Cis, Condition. Bronch, Bronchial Tube. Cardi, Heart. Cephal, Head. Cervic, Neck, Cervix. Colp, Vagina. Contra, Against, Opposite. Crony, Skull. Cry, Cold. Cyan, Blue. Dacry, Tear. Dactyl, Fingers, Toes. Lack of, Down. Demi, Half. Derm, Dermat, Skin. DEXTR, Right. D2. Dis, Separation. Dynia, Pain. Dice, Bad, Painful. Ectomy, Excision removal. Emesis, Vomiting. Amaya, Blood condition. In, within. Endo, in, within. Epi, above, upon. ERYTHR, red. Aesthesia, nervous sensation. Eating, cause. X, out, away from. Extra, outside. FIBR, fiber. For, before. Gallect, lacked, milk. gaster, gastr, stomach. Genet, genitals. Gloss, tongue. Gluck like, sugar, glucose. Gram, record. Graph, instrument for reading. Graphy, process of recording. Gyn, gynec, women, female. Hem, blood. Hema, blood. Hemat, blood. Hemi, half. Hepat, liver. Hypith, below, under. Hyper, above, excessive. Hyster, uterus, womb. Ia, condition. Isis, condition. Ic, pertaining to. Ilio, ilium. Ilio, ilium. In, into, not. Infra, within, into. Inter, between. Intro, within, into. Ipsi, same. Itis, inflammation. Juxta, near. Beneficiary Counseling and Assistance Coordinator. Individual available at military treatment facility to answer questions, help solve healthcare-related problems, and assist beneficiaries in obtaining medical care through TRICARE, was previously called Health Benefits Advisor. Benefit period. Begins with the first day of hospitalization and ends when the patient has been out of the hospital for 60 consecutive days. Benign, not cancerous. Billing entity. The legal business name of the provider's practice. Birthday rule. Determines coverage by primary and secondary policies when each parent subscribes to a different health insurance plan. Black box edits. Non-published code edits which were discontinued in 2000. Blue Card Program. Program that allows BCBS subscribers to receive local Blue Plan healthcare benefits while traveling or living outside of their plan's area. Blue Cross. Insurance plan created in 1929 when Baylor University Hospital in Dallas, Texas approached teachers in Dallas School District with a plan that guaranteed up to 21 days of hospitalization per year for subscribers and each dependent for a $6 annual premium. Blue Cross Blue Shield. Joint venture between Blue Cross and Blue Shield where the corporation shared one building and computer. The coding system currently in use to report diagnoses and reasons for encounter is the International Classification of Diseases 9th Revision Clinical Modification. The person who prepares and reviews claims for accuracy to ensure prompt payment is the Health Insurance Specialist. Medical ethics are principles of right or good conduct. A person who performs services for another under an expressed or implied agreement is called a independent contractor, which is an authorization that must be received from a payer before treatment by a specialist will be covered. Pre-authorization. Which coding system is used to report professional services to payers? Current procedural terminology. Which is a crucial skill that all health insurance specialists should learn in their training coursework. Fluency in the language of medicine. Which is a professional member of the healthcare team who provides services or supplies to the insured healthcare provider. Which is the universal claim form used by physicians' offices, Centers of Medicare and Medicaid Services 150. Which document is mailed by the payer to the patient to illustrate the reimbursement amount of a covered benefit. Explanation of benefits. Which term means the patient is not responsible for paying for what the insurance plan denies. Hold harmless clause. Which document communicates to the payer that the provider is requesting reimbursement. Health insurance claim. Which professional association was founded to elevate the standards of medical coding by providing certification, ongoing education, networking, and recognition for coders. American Academy of Professional Coders, which professional association was founded to improve the quality of medical records and current advances toward an electronic and global environment, including the implementation of ICD 10 cm. American Health Information Management Association, which is a legal term that indicates that providers' responsibility for their employees' actions and omissions. Blue Cross Blue Shield, joint venture between Blue Cross and Blue Shield, where the corporations shared one building and computer services but maintained separate corporate identities. Blue Cross Blue Shield Association, an association of independent Blue Cross Blue Shield plans. Blue Shield began as a resolution passed by the House of Delegates at an American Medical Association meetings in 1938. Incorporates the concept of voluntary health insurance that encourages physicians to cooperate with prepaid health plans. Blue Worldwide Expat provides global medical coverage for active employees and their dependents who spend more than 6 months outside the United States for 6 months or more is eligible for Blue World Expat. Bonding insurance, an insurance agreement that guarantees repayment for financial losses resulting from the act or failure to act of an employee. It protects the financial operations of the employer. Breach of confidentiality, unauthorized release of patient information to third party. Business liability insurance, protect business assets and covers the cost of lawsuits resulting from bodily injury and false advertising. Cafeteria Plan, also called Triple Option Plan, provides different health benefits plans and extra coverage options through an insurer or third-party administrator. Capitation, provider accepts pre-established payments for providing healthcare services to enrollees over a period of time. Carcinoma Instu, a malignant tumor that is localized, circumscribed, encapsulated, and non-invasive. Care Plan Oversight Services cover the physician's time supervising a complex and multidisciplinary care treatment program for a specific patient who is under the care of a home health agency, hospice, or nursing facility. Case law, also common law based on a court decision that establishes a precedent. Case management, development of patient care plans to coordinate and provide care for complicated cases in a cost-effective manner. Case management services, process by which an attending physician coordinates and supervises care provided to patient by other providers. Process by which an attending physician coordinates and supervises care provided to patient by other providers. Case manager submits written confirmation authorizing treatment to provider. Case mix, the types and categories of patients treated by a healthcare provider. Catastrophic cap benefit protects TRICARE beneficiaries from devastating financial loss due to serious illness or long-term treatment by establishing limits over which payments is not required. Catchment Area, the region defined by code boundaries within a 40-mile radius of a military treatment facility. Category I codes, procedures/services identified by a 5-digit CPT code and descriptor nomenclature. These codes are traditionally associated with CPT and organized within 6 sections. Category II codes, optional performance measurement tracking codes that are assigned an alphanumeric identifier with a letter in the last field. These codes will be located after the medicine section. Their use is optional. Category III codes, temporary codes for data collection purposes that are assigned an alphanumeric identifier with a letter in the last field. These codes are located after the medicine section and will be archived after 5 years unless accepted for placement within Category I sections of CPT.